Our disability is our greatest strength. It gives us a supervision to see the issues facing humanity from a more inclusive perspective and the grit to fight back against all odds. Welcome to Super Adaptables, the More Than Walking Video podcast discussion. Welcome to Super Adaptables, the podcast where people of all abilities gather to discuss pressing issues that affect the disability community and their implications for the world at large. We are your host. I am Corey Pheez Lee, C4 complete quadriplegic since 2005.
And I'm Jonathan Sigworth, C7 complete quadriplegic since 2006, both of us hailing from the great state of Connecticut.
A very cold state. At that, it is 29 degrees, freezing outside. We're recording this on Thursday, the 23rd of January, 2025, and in a little bit, we'll be discussing preserving social safety nets in Connecticut with special guest Carol Scully, who is the Director of Advocacy for the ARC Connecticut, which is an organization whose mission is to advocate for protecting the rights of individuals with intellectual and developmental disabilities and promoting opportunities for their full inclusion in their communities.
And before we do, I just want to let you know, as always, that Super Adaptables this year is made possible in part by a grant from the Christopher and Dana Reeve Foundation's National Paralysis Resource Center. The information provided and opinions expressed in these podcasts do not necessarily reflect the views of the Christopher and Dana Reeve Foundation. For more information about the Foundation's National Paralysis Resource Center, visit www.christopherreeve.org. Also, the views expressed in this podcast do not necessarily reflect those of More Than Walking either, but belong to us as individual speakers. But Carol, thank you so much for being here. We're really happy to be speaking with you today.
Thank you for inviting me. It's a privilege to be here and talk about our work.
Awesome. Well, in the last episode, we discussed the many social safety nets available in the U.S. Our conversation focused on the effects of these programs on the national level. But what about here in Connecticut? For example, according to one analysis, Connecticut ranks number 2 with the highest median monthly Social Security check sent out at $2,084. Seems like a lot, right? But while the position is high on the list, many are still suffering and living below the poverty line.
And with so many important programs available, there are many pros and cons and different context factors to weigh about these programs' efficacy, how they can be improved, to continue the fight for community access for everyone. And, Carol, I'm so happy we're meeting with you because we've worked together in the past, especially on, our local wheelchair repair bill and other issues that affect people of all different types of disabilities and even those without disabilities yet. I think the big question that we want to get to the bottom of at various levels is kind of what is on the agenda in Connecticut, what's on the chopping block potentially. What should people be thinking about locally in terms of social safety nets here, and what's happening with the legislative session this year?
So the legislative session, I just tuned in this morning to Appropriations and Human Services talking about the Medicaid rates. And it's the rates they actually pay the providers, which we are surprisingly low. So it looks like there's some support for increasing those rates to the providers, meaning a doctor or a psychiatrist or a social worker or whoever is covered under Medicaid, a mental health professional. And that would be amazing, except on the federal side, there are, the executive orders being issued disproportionately are going to affect the disability community, the elderly, needy families, people who just can't find jobs or are chronically underpaid in their jobs. Not that they don't work, they work really hard, they just don't make enough money to sustain their families. And this is not going to get better from what I'm seeing today, which some excerpts that came out. On the state side, it looks like we're trying to protect those rights and as best we can as a state protect the people that we serve. So we may have state protections, there may be some freezes depending upon what onus is put on the states financially to provide those services. For instance, the discussion around having Medicaid come down as a block grant and maybe not even funded at the same level as Medicaid is funded to all the other states. So the block grant system is kind of a chunk of money that comes down to the state, and then the state disperses it. There's no requirement within that block grant to appropriate it as though it was the appropriation from the federal government. So in other words, some entity within the state could get less. So Medicaid could get less, or other safety net services could get less.
Wow, that's really interesting. You said that you saw like some excerpts that came out. What executive orders have you heard that would affect CT benefits?
So let me try to pull that up for you. I'm going to read off of an email I sent out a little while ago. Just a sort of heads up. I'm still reading the document, to be honest.
No, I know these things. I've had such a hard time keeping track because everyone's saying, "Oh, Trump is so busy, getting stuff done," and I'm like,
Oh,
yeah, not much of it good, maybe.
yes. So
Productivity is not what it used to be.
I think you're right. That's in the eye of the beholder, as they say. It's very politically divided, unfortunately.
Yes.
So I sent to just a few members of our board, just a quick heads up on SSI, which I know probably affects you guys and a lot of the people that are listening to this podcast. So it's couched this way: improve Social Security income and asset verification. SSI provides cash assistance to aged, blind, and disabled individuals with little or no income. Under current law, Social Security Administration is not required to verify financial accounts of SSI applicants and recipients who allege ownership of resources valued at less than $400. A recent SSA, Social Security Administration, and OIG, Office of something government, I'm not sure what, report concluded for this practice reported that this practice led to incorrect resource determinations, resulting in 198,960 recipients receiving $718 million too much. So they're going to try to pull that back. I won't read you the whole thing, but I can certainly send it to you, Jonathan, for your reading.
So just on that subject alone, are you saying that essentially they want to tap into people's personal accounts to see if they have quote unquote wealth on their side, like their account is full? Is that to reduce what they are currently receiving as far as Social Security is concerned?
Well, I think that's kind of a fair assessment of what I just read. I don't think it's unfair. I don't think it specifically says that, but it implies that. Mm-hmm. So I also would have to do fact checking because I'm not sure myself some of this information is 100% accurate, like resources valued at less than $400. Right. SSI, I believe, has $1,600 as an asset limit.
Either way, it sounds like the feared side effect will be that, sure, in trying to run after some amount of dollars that may have been over distributed, the net result is going to be the amount of time it takes to make a determination is going to significantly increase, and people are going to get caught up in that verification process one way or another, that they need the help urgently and they're just not going to be able to get it. And Corey and I have discussed this previously in the podcast, that if you're concerned about fraud, with social safety net programs and money not being spent as it should be, consider the amount of funds that the IRS is not able to recoup because of tax loopholes with the ultra wealthy. And if you compare the money that the IRS is missing out in terms of what they could collect and the amount that is supposedly being defrauded of the government through social safety net, they do not compare. It is overwhelmingly much more that could be collected in taxes by the super rich. I know that there are other things, such as executive orders coming down that would potentially cut the spending caps for Connecticut's programs for Medicaid. Mm-hmm. But we haven't seen anything along those lines yet concretely, have we? Or is that just a general? Okay.
But the document, I'll send it to you later. The document is really quite extensive, but yes, those cuts are in the works. So the taxes, which you just mentioned, the plan is they're reducing some of the tax deductions that were allowed, and then they're reducing the tax required for people who are ultra wealthy. So Biden had raised that. He wanted to raise it to 35%. I think that they settled on 21%. It's going to be back down to 15%, which means, again, that middle and lower income America will be paying the largest burden of the taxes.
Yeah.
Um,
So apart from those impact on Social Security and Medicaid, what are other things that we should be looking at, locally, that relating to social safety nets, or about housing or any other programs that you think we should be keeping on our radar this year?
I think you need to keep an eye on Human Services Committee. I think their goal is, in general, to try their best to maintain the services at the rate they are. I mean, there was clearly consensus in the meeting this morning around the fact that the Medicaid reimbursement rates were low compared to other states. They try to compare sort of states that are equal to us. So Maine was compared, for instance, Massachusetts was compared, Oregon, which no one fully understands why they were compared, but they were compared. And I think we need to watch that. I think we need to watch how the state deals with affordable housing, because there could be an even greater housing crisis if people have reduced incomes and won't be able to pay their rents. And I think we need to be looking at tenants' rights across the board, especially for people who have disabilities and their rent is subsidized in some way, shape, or form by either state funding or Section 8 and RAP certificates, which are federally subsidized. I think we need to be making sure that the changes proposed to Husky A last year, which affected families, that especially families that had children with disabilities, that they took 15,000 of those families and they wanted to put them on the health exchange. The health exchange subsidies on the federal side look like they're going to be reduced. So how do we take care of those families? Because part of the problem was the 15,000 that were dropped were 15,000 households who one parent or the other had a job who provided medical insurance, but the high deductible medical insurance that was also very expensive. So it might not have been, affordable for that family to actually buy one of those plans, but yet we took Husky A and we put those people on the exchange because they could. So I think we need to be looking at how the state responds to the federal cuts and how they protect all the residents of Connecticut, and especially the vulnerable ones.
Yeah, speaking about just, we talked about the different groups who will be impacted by the decisions that are coming down from the federal government on the state level. As an advocate, what kind of defense mechanisms are there for the most vulnerable? I know there was talk about, civil rights cases, like new ones aren't going to be able to get put forth. That's one thing that I heard recently on the news. It seems like some of these could possibly violate civil rights. So how can people with disabilities who are listening and protect themselves from the effects of these changes?
That's a really good question. So on both your state side, and hopefully this broadcast goes beyond Connecticut, both on the state side and your federal representatives, especially if you have Republican representatives representing you in the federal government, express your dissatisfaction with whatever executive orders are coming down that you don't like, and whatever may affect your family, your income, your ability to provide for your family, your ability to get a job. And be loud and be constant and constantly tell them how you feel. On the state side, you do the same thing with your representatives. If you don't agree with legislation coming out, I heard yesterday morning a representative say it takes as little for her district, for her to pay attention, as 5 people calling about the same issue. So I think that was really good advice, that your voice actually counts, and to make your voice heard, and never be afraid to express what you believe.
That's encouraging to hear that it just takes 5 people. And, when we were talking with some other expert advocates last week, they say, share your story and include a picture if you can, just to make sure that people can see you for who you are. Picture with your disability, if you have one, picture you in your wheelchair or whatnot, to make it real for people. And I heard on another podcast, I think it was the Wheelhouse, the Lieutenant Governor of Connecticut mentioned that there's a possibility that they may be looking at Connecticut's rainy day fund and the fiscal guardrails in a different light, in light of some of these things, and looking at the current political situation and the future of these benefit programs as, in fact, a rainy day that we need to take care of. Can you explain for our listeners who are not from Connecticut, because we do have a small but growing national audience, what is the situation with fiscal guardrails and Connecticut's rainy day fund? What's the controversy and tension, pros and cons around it first? And then have you heard anything about how the current situation might be viewed by the administration here in the state?
So the fiscal guardrails were implemented in 2017 after many years of the state of Connecticut running a deficit budget. So it was put into place to try to not spend all the revenue coming in and trying to save some and reserve some for the debt that we had to pay down. And a lot of that was state employee union pension debt. So they created these, and they call them guardrails, but they're really fiscal controls, which is probably a better way of saying it, because guardrail can be misconstrued as something positive or something negative, either way you want to look at it. So one of the ways they saved revenue and didn't put it back into the state budget was the rainy day fund. And there's a whole formula behind how they put money into the rainy day fund. But getting at the heart of your question, I haven't heard specifically that they're going to use the rainy day fund, but it also doesn't surprise me. So I think that the governor and the lieutenant governor and the state treasurer and the comptroller and the attorney general are all going to be looking at ways to protect the people of Connecticut, whether it's through the Connecticut financing some of the things the federal government would have financed through the rainy day fund, or just through legislation and in the sovereign power of the state that it already holds. So I'm not surprised that she might have said something. My sense in what is being said at the state level here is that everything's on the table.
And I mean, that is, I was reassured when I heard that, but also not sure exactly what to believe. I mean, when we're thinking about focusing on the Human Services Committee, which again is that's where issues on Medicaid and those benefit programs and a lot of the disability services are decided upon. Is there any hope, do you think, in expanding benefits during this time, especially things that are not necessarily related to the budget, like the Medicaid buy-in program for workers with disabilities, for example? This program provides Medicaid insurance to people. It's the only insurance plan that pays for caregiving and things that people with very high level disabilities need in order to survive and live day to day. And yet, Connecticut still has an income and asset limit that's based on things back in the 80s. Other states have no income or asset limits, even more conservative states than Connecticut. And lifting those wouldn't necessarily eat into the budget and actually help make residents with disabilities even more productive. But again, it has this aura to it of expanding benefit programs, which sounds like there's only a cost associated with that as opposed to an economic opportunity. But yeah, just wanted to get your thoughts on that.
So I did hear yesterday that the Insurance and Real Estate Commission will be entertaining legislation that will expand that health insurance marketplace and potentially include small not-for-profits and other groups that, need to buy into an insurance program, a health insurance program. So yeah, I think there's hope there. And I think there's some hope in expanding some of the waivers. But I think that depends upon what the federal opposition is going to be, who sues the federal government over the proposed cuts in Medicare and Medicaid. So I think that's a little dependent, and I think that's where you're referring that the rainy day fund may come into play. I don't see them reducing benefits. I do see them trying to come up with a plan to maintain the Husky program, the Medicaid program, which we call Husky here in Connecticut, at the same levels that currently exist.
Of all the different programs that are available, which of the legislative issues do you think are the hardest to fight versus which ones you think are the easiest?
In the past, legislatively, the hardest issues have been the fiscal controls. I think that there's proposed legislation currently to revisit them. And if not all of them, at least some of the ones that will release some money. I think we also had a slight reprieve when it was announced that interest on banked ARPA funds hadn't been included in the budget, and that's several $100 million worth. So that's more money that hasn't been earmarked for anything yet. It hasn't been accounted for in the budget. The budget will come out February 5th, the governor's budget. So it'll be really interesting to see what appears in that budget.
What about housing? I know that I just heard something from, again, the wheelhouse from Connecticut Public. Last year, the housing bill wasn't even voted on. It didn't even get to the finish line. Do you know anything about the housing situation? Because I know that's also a pressing issue.
And that's one of our priorities as well. So the Senate didn't vote on are you referring to Work, Live, Ride?
I don't recall the exact name, but
so one passed the House and one didn't get voted on in the Senate at the very last second. That was increasing housing around transportation hubs. It didn't really matter what the hub was. It could have been rail, it could have been bus. A lot of it was around Metro North that's being proposed. It's an interesting concept, and it's one that will increase housing and one that we support because it does increase housing. There are other initiatives that didn't get as much traction, like workplace housing for workers specifically near manufacturing plants. I know that Stanley Black & Decker was behind that, Electric Boat, General Dynamics Electric Boat was behind that. I think that'll come up again because we do need worker housing. And within that worker housing, we could also advocate for housing for people with disabilities and the elderly and make it, more community-based housing where it's a community that reflects the entire community and the people that live there. And that means everyone. With disability, not based on race, not based on gender, not based on anything, just the fact that our communities are multicultural in many ways.
And I mean, and I've, I know I've been speaking with people in other states, and I was, when I was soon after I was injured, I got accommodations with accessible and affordable housing, and remember being on the wait list for, several months, if not a year. I don't know how long the wait list is now, but looking back at the housing options that are available, say in the city of New Haven for people with disabilities, these are buildings that are so old, and they're just in total disrepair. And it just seems that is a pressing issue for so many people, especially when we're trying to keep people out of nursing homes, post injury. And then I also wanted to ask, what's happening in terms of the privatization of managing Medicaid recipients? Have you any update on that?
Managed care, MCOs.
Yeah, and can you explain a little bit about what that is and how Connecticut has been different and the implications of that difference?
Yeah, so that was part of the hearing this morning between Human Services and Appropriations. It was the discussion around the recent report on the rate study, and that's DSS's rate study. So 12 years ago, I think it was, we had in this state what's called managed Medicaid, just like managed Medicare. So a private insurance company like Blue Cross, Blue Shield, depending upon where you live in Connecticut, it's called Anthem, or we have other insurance companies that provide that service, that it's a private insurer that manages your Medicaid, just like it would manage your Medicare. So 12 years ago, there was a group of advocates that managed to eradicate that. It's coming back because a lot of states have managed Medicaid. We are one of the exceptions, but a recent study of our Medicaid program said actually we have a pretty good Medicaid program and we're running it fairly well. And we don't need to sort of make changes, significant changes that might impact the services, kind of like upsetting the apple cart. We don't want to necessarily bring a managed care company in because they're also paid to manage that. And like managed Medicare, Medicare pays that management insurance company a flat fee per month to manage your health care, whether you use the service or not. So there is a lot of incentive for an insurance company to want to do that service because they play the odds. But
Right, a flat fee per person. So if you have two people, one person has a sprained ankle, the other person is paralyzed and needs a $40,000 wheelchair and 24-hour care assistance, they're getting paid to care for both people. And so there's an incentive to deny care for the people who have more expenses.
there is. It's embedded in the system. If you look at it
That's
that
embedded in insurance in general.
way.
And one of the the implications, the effects of that we've seen in other states is if you go from a rehab hospital and your house isn't modified yet, it's not ready for you to come home, after 2 weeks of inpatient rehab, you are then sent to a nursing facility before getting your wheelchair. And because you're in a nursing facility, these MCOs or managed care organizations don't feel the need to spend the money on a $40,000 wheelchair when you are in a facility that can theoretically care for your every need. And so why do you need to have an independent mobility device at that moment? And so they deny delivering or paying for it until you get discharged from the nursing home. And the catch-22 is, without access to one of these mobility devices like a wheelchair, like you can't learn to live in the community. There is a learning curve to using wheelchairs, and there's no way that you can prepare to be discharged from a nursing home out to your home or an apartment building to live on your own if you don't have time to acclimate and get used to your wheelchair. So people are then, they're stuck. They can't leave the nursing home without a wheelchair, and they can't get their wheelchair until they leave the nursing home. And it's a total waste of funding because these nursing homes are expensive. And it's just really sad because people aren't getting a right to their mobility device, which is incredible that that's happening in this day and age.
And if I just may add right before you, continue to finish your point, I constantly think about, the event that happened down in New Orleans and how a gentleman got his wheelchair completely destroyed because of the perpetrator. And, you know, one of the things that one of the news casters or reporters said, if anybody would like to donate, right, that's the first thing that we have to kind of turn to is crowdfunding to replace something where that should be an immediate need. And you should be able to go to your insurance without worry or fear that it's going to be too expensive of a cost to be able to get back that same wheelchair that leads to your mobility, that leads to you being able to be discharged from the hospitals and getting back into the community that you were just a part of when you had your wheelchair intact.
That's correct. Well, I see it as a coordination of services, and that's not what's happening here. You're not coordinating the rehab pieces in the nursing home with the need to have your wheelchair to be rehabbed in the nursing home. So you look at how much farther you would have gotten in your recovery and your ability to use that wheelchair if you had it in a nursing home and were getting PT there. I mean, it's a lack of coordination.
So, and did you say that managed Medicaid is not coming back to Connecticut, or it is? I know it was being considered, but what are you hearing right now?
There's been no final determination. If it comes back, oddly, it will come back because of the higher cost of treating people with disabilities. Only for that population was the result of the report, which there are advocates across the state, myself included, that are protesting that, or protesting probably isn't the right word, but are questioning.
Oh, it is. It is. So that is still a real threat that we should be looking at riling people up about this term, or will that be a legislative thing, or will that be top down, like not even in a bill kind of change?
Yeah, we submitted our questions and concerns. I don't know that we've gotten a reply back, so we'll have to double check that. I think we'll rally the troops when we need them. Right now, I don't think we have the answers we need in order to properly inform you so you can advocate.
Yeah.
But I think we might win that one. Maybe I'm just being optimistic, but it does seem a little discriminatory when you just want to manage the care of the people who are costing the most, and that's people with disabilities. And we have lots of questions around why that's costing more. And it's in long-term care, so there's different long-term cares across the systems. So there's one definition of long-term care, for instance, in aging and disability services, and then there's one definition of long-term care in the Department of Developmental Services. So I think we don't have the answers yet.
Okay, but we should stay tuned.
Yeah.
Yes.
What timeline advocates should have in mind regarding the legislative session?
So the sessions last until early June. I think we'll keep you informed as far as when things come up before both Human Services, Public Health would be the presiding committees of cognizance, and Appropriations.
So the session ends in June, in early June.
Mm-hmm.
So between now and then, are there any specific key moments for advocates to be heard, or is it just a growing crescendo up until the end of a legislative session that should be the goal?
Well, that's a really good question. I think that's a preference. I think what I see as the most effective is when you actually go to the hearings and you testify, just like we did for the wheelchair reform bills. I think that has more impact.
Yeah.
I think to rally around the specific legislation and tell your story, how it specifically affects you, is important. And back to your earlier statement about the pictures, I think that works really well on the state side. I'm not sure I would do that on the federal side. I'm not sure that those hearts will be
Get lost in the shuffle.
well, I'm not sure they have hearts, but that's just my personal opinion.
Well, so this brings up another really good point. Is it um, so no matter what state you're in, if you're not in Connecticut, we still want this to be applicable to you too. So look for the bills. We're talking about the Connecticut legislative session. Every state has a different legislative session timeline. And we need to be aware of what those laws and policies that are being considered. And again, look up, find the dates and times of those public hearings and attend them virtually or in person if you can. Sounds like a good idea. But what can we do on the federal level as advocates if sending in an email or a letter with a photo isn't effective at the federal level? What can we do in that regard? How do we reach out to our Connecticut or our state senators and representatives in the Capitol? What would you suggest?
Thank you. I think what I suggest is to make it clear that this is the legislation you who voted them into office. If you did or didn't vote for them, it doesn't matter because they don't know that. They are representing you. So they are your representative. They represent your interests, and you tell them what you want them to represent. And it's not what they want to represent. They're representing their state. They're representing the people who put them in office. And that you have to drive home. And I think saying that if your interests aren't represented, then you will not be voting for them. I think it's a fair statement. I mean, if you listen to national news and they're saying that the Republican representatives and senators are afraid that they will be challenged in a primary if they don't vote the GOP ticket or policy line, that you have that equal ability to tell them if they don't vote the people of their state's policy line, they also won't be in office. So I think it's a fair way to assert your vote. It is your vote. I think sometimes when they get to Washington and it's so big and the policies and the politics are so intricate that they forget who they're representing. It's not their own interests, and it's not the interests of big business. It's the interests of the people of the state they represent.
We hold the power, and they are representing us, and our vote matters, especially as in terms of whether or not they have a job the next go around. So reminding them of that is useful. And also at the local level, or those types of threats.
So I think that they're all
I shouldn't call it threats, but that reminder.
That's a great way of putting it. That reminder that they serve at the pleasure of the people. How's that? And I don't think that's an unfair reminder. You elect them to represent you and your interests. And there are collective interests, and there are two sides to every story. So they do have to weigh both sides. But I think the more you assert your side, the more voices they hear on one side or another. And I heard one politician say, it's the last voice in your ear that you're going to listen to, that vote. So make sure you're the last voice in their ear, or a constant voice in their ear.
I think part of what that reminder to them kind of gets, a little dull in the minds of the voters is something that, I and John have spoken about on podcasts, we've talked privately about, is that there is a great distrust in politics, and that people, generally speaking, feel like their vote doesn't even matter, that it's already a foregone conclusion that this elected official is going to be selected. So whether I go to the ballot or not, it doesn't matter. And then those who oppose maybe the legislation you support or that you want to push forward, oftentimes you hear a rebuttal. Well, the American people have spoken. Well, I didn't speak on behalf of that. You know what I mean? So it's like trying to figure out your representative, and being that you're part of their constituency, when you voted them when they were on ballot, how much information and how informed were you? And I think it's necessary for podcasts such as what we do here with Super Adaptables and More Than Walking is to get that information and speak with the people who are advocating directly, such as yourself. And we appreciate that work because not every population group understands the process or understands the complexities and the nuances. You work with those with, intellectual disabilities, learning disabilities. If you're like, well, this is the Medicaid buy-in program and this and that and the third, they may be like, what? When they're already underneath a caretaker or a caregiver, you know what I mean? So these things have to be fleshed out in a tangible, reasonable fashion that can be, understood by all people who at some point in time will depend on these programs. We famously kind of say that you may not have a disability now, but down the road you sure will. Or, the reason why these programs need to be expanded, because you may have children, grandchildren down the line that will be entitled to these programs. And it's important that they have access, just like any other citizen here, whether you're in Connecticut or, somewhere else in the United States.
Exactly. And I caution people to, I've been cautioning people who have been asking me about who to trust and what trusted news sources should you trust. And I will say that you need to expand your news sources, that you can't get all your news from social media, that they are driven by algorithms, and the algorithms are created by people who have agendas in mind. So social media is probably not the best place to get your news. So look at some conservative papers, look at some liberal papers, look at some online news sources, and I don't mean print papers, online news sources that are in the middle, and take all that information and just digest it and think about it and think about what's right for you. I really encourage people to go beyond their comfort zone and read other opinions, because it's really important not to get caught in the social media, cycle of just saying one side of the story all of the time, because that's not helpful to anyone.
And I guess that's also very practical, because let's say your representative or your senator ends up, going in that their poly position of their party or their caucus is against your interests. How do you approach writing to someone like that? It can't just be yelling and swearing, and we never encourage anyone to threaten a representative or speak disrespectful. But you need to be able to articulate your story and your needs in a way that challenges their misconceptions or a way that challenges their assumptions. And that has to be in a somewhat vulnerable and empathetic way. Otherwise, it's not going to be heard. And I guess on that note, Carol, do you have any advice about how to do that? Have you seen, in your own personal professional life, and experience advocating, what, any instances where people, you've seen politicians go from one position to another because of, a compelling interaction with an advocate, or any general tips about how to create those compelling interactions, whether it's through an email or a phone call or anything.
Well, I'll say a couple of things. I'll start with just the juxtaposition of two really well-known politicians in wheelchairs. One is the governor of Texas, and one was our president. And they have both very powerful voices. So I would say that if you're looking to change policies around disabilities, I would point out that we had two really important politicians that were in wheelchairs. And then I will point you to a resource, the American Association of People with Disabilities, AAPD. Their SARTAC division, which is kind of a revving up the vote kind of division, has a really good toolkit for people with disabilities to self-advocate. So that's a really good resource about how to advocate respectfully. And definitely be respectful. Anytime you're talking to legislators, be really respectful. And you can agree to disagree, and you can point that out respectfully. I'm sorry, I would like to disagree with that opinion, but I think I would just stand firm, be strong, because the minute they oppose you, they expect you to back down. Don't back down. You have an opinion, you have a political priority that you need them to follow up on. You keep talking about it. You talk about how it affects you and other people you know, and ask them, is anyone in your family in a wheelchair? Does anyone in your family have a disability, or even a learning disability? We had a governor with ADHD here in Connecticut. I mean, it's not unusual to be successful and have a disability of any kind. So the fact that you feel marginalized because you have a disability is not on you, it's on them.
Yeah, I think that's really powerful, reminding them of Franklin Delano Roosevelt, who was perhaps the most impactful president in our modern era, who had to hide his disability and really help jumpstart some of the social safety net programs that we're trying to preserve and improve, and reminding them that it is the system that really creates disability. It's not the condition. And people with disabilities in that regard are people that society have failed in a certain light. If there were ramps everywhere, it wouldn't matter if I had a wheelchair or not. I would just, be like every other citizen. So that's an important point to remind our politicians of those success stories and things to counter the narrative that we hear so often. But yeah, thank you so much, Carol, for speaking with us. Corey, you had any final thoughts?
No, I think this is just a very healthy discussion regarding how we can approach things today to better tomorrow, so that all benefit from it in some way, shape, or form. And I would also say that expansion of any program needs to be there, because society and the world is constantly progressing and changing. And the earlier you do it, it's I think was it forgot the adage is like a pound of prevention or something. Prevention equals a pound of cure or something to that effect. So it's like if you do a little bit now to secure a better future for tomorrow, and that's simply our aim. Within the disability community and beyond. But again, thank you, Carol, so much for joining us, and thank you everybody who will be tuning in to watch this.
And stay tuned in and join us next month and sign up for the More Than Walking newsletter at morethanwalking.com to learn about the topic we will cover next. Also, like, comment, and subscribe to our More Than Walking YouTube channel to watch each podcast. And we'll be dropping new episodes every Monday. And you can follow us wherever you listen to podcasts. Just search for More Than Walking.
So until then, remain encouraged, stay hopeful, and above all else,
keep adapting.